Okay, so the first video that we're talking about today, the topic that I picked is how common it is to feel like absolute trash while you're on your period, right? It seems like all my friends hate their periods. I've hated my period, and that's just kind of see, it's just like a normal thing to hate your period. But I think that you have different opinions on that. So, and from your medical perspective, in maybe layman's terms, how bad should we tolerate feeling while we're on our period before we try to get help to make a change?
Okay. It's a broad subject. Unfortunately, a lot of women have grown to tolerate the side effects and the bad feelings of their period. So they don't know that a period should come like sun up and sun down, right? It should just happen. No symptoms. You go to the bathroom.
Oops, what do you mean no?
My period is here.
You said no symptoms.
Well, a lot of women complain of PMS, right? Premenstrual syndrome, premenstrual dysphoric disorder, where they have more of those neuro type of symptoms. They have a lot of anxiety, irritability. They feel like they're ready to chop anybody's head off. It's just anticipatorily to the time of the period onset, they feel miserable. Plus, they can have cramps, nausea, abdominal pain. They can gain weight, bloating, water retention, all of those things. Those are regarded as normal. If you're a woman, you should just expect to have those kind of symptoms. It's that time of the month. That's okay. That's not okay. That's really not okay. All of those are symptoms that in the background, something else is going on. Something is brewing. Something is just not working well. So as long as we bring awareness that these symptoms are negative, that these symptoms are triggering underlying pathology that needs to be looked at. Maybe it's just hormonal imbalance. Maybe it is insulin, blood sugar dysfunction that needs to be looked at. A lot of teenagers, when they start having their periods, they're not going to automatically all be ovulatory cycles. So they will struggle with higher levels of estrogen. They will struggle with heavier menses, prolonged menses. They may not be irregular. They may not happen every 28 to 30 days. They may eat a lot of candy and junk food and things that, teenagers kind of do. It's a matter of regulating everything else that would lead to normalization of those periods. So we should not accept the fact that if you're a woman and you have a period, you have to suffer. This is normal. That is not normal. The period should occur. It comes, it goes, just like life moves on, but without the annoying symptoms, right? And I love my period. Okay. And I'm not saying it because I want to stand out. This has been for me for years. I really love it. I welcome my period. It's a time of self-care. I am introspection, and I just feel mellow. All my hormones are low. So there's no anxiety, there's no irritability, there's no drive to do anything. I just feel like myself, and I love it. And the flow doesn't bother me. And I don't have clots. I don't have heavy bleeds that, would hinder my ability to be social. So I love my period.
You know how many women are hearing this or seeing this and they're like, are you kidding me? Like, I'm on the floor in like convulsions on my period. Like, that is a really revolutionary thing to say to people.
But we can get you to feel better. So you can love and enjoy your period.
So exciting.
And you don't have to miserably go through 48, 52 years of periods feeling miserably, right?
It's crazy. Okay, so we're going to stop recording this video. The next video we're going to record is about cycle length, cycle time. And I think you're going to be very surprised at what you hear. So thank you for listening to that little spiel about how much we can improve our lives overall. This is going to be amazing. You're so awesome.
I think so.
Do you hear her? She's amazing.
Katie's amazing too. But sign up so you can hear more.
Yes.